So the first thing we want to talk about is how to create wealth using health insurance. What is wealth? Wealth is what? What do you understand when we say wealth? Wealth, as if you remember our last video, we defined wealth as uh, the abundance of valuable possessions. So if you have value, if you have something of value and you can have more of it, if you have abundance of it, then you are wealthy in that thing. In other words, if you have money and you have more of money, you are wealthy, right? Or if you have properties, if you have houses, if you have real estate and you have more of it, you are wealthy in real estate, right? It transforms into money in that regard. And then also we said that even your own body, if you have health, you are wealthy in also in your physical body. You are wealthy in that regard. So that is that. But we're going to narrow ourselves at least to the financial aspect today as we move forward. And so that is that for wealth. Now, what is also insurance? You want to chip in some?
Yeah, insurance is the transfer of risk. So the something happened to you and you have insurance. Instead of dealing it yourself, spending all the money that is necessary, you just transfer that problem or that risk to a third party, which happens to be the insurance company. So, insurance basically is the transfer of risk. We are all at risk. Like something can happen to anybody at any point. So, having insurance, meaning that you're not going to deal with that situation yourself, that situation have to be transferred to a third party, and that happens to be the insurance company. So, it's a transfer of risk.
All right. So insurance, the transfer of risk, and in this case, as she said, the risk being a risk of being sick. Let me close a little bit. Right, a risk of being sick. All right. So that is that. Now let's move forward to next slide. We're saying that. So how does health even affect your wealth? Now, somebody may say that, well, if you're talking about health insurance, let's talk about health insurance. How does that affect your wealth? And we want to explore that. Why do we think that having health insurance you can use that to leverage your wealth or your financial position? How does it help? How does that affect your wealth? And we're saying that the first one I'm going to start is the cost or expense at the time of being sick. Now, if you know at least how much things cost today to take care of sick patients, or either patients on admission in the hospitals or even managing chronic ailments, then you definitely understand what we are talking about. It is expensive to take care of the sick. We're going to go into details later, but yeah.
Cost. Yeah, I think most of us are not aware of how expensive health, like when you're
Healthcare.
sick, like how expensive some health conditions can become. I think I watched a video about somebody who said that she just got appendix and it needed to be removed, and she went to the hospital, and they brought the expenses of staying in the hospital for only for 3 days, and she was going through the cost, and it's like what 25,000 to 30,000 for just staying in the hospital for 3 days, and she was going through the doctor's costs, staying in the hospital, the room, the monitors that they use on you, everything, even whatever they use for the surgery, everything has a price tag, and it's so high. It's so high. So if you really want to know how much it costs when you go to a hospital or somebody happens to be in a hospital, just take a peek at the expenses that they give to the person after the person is released. It's so much, it's so expensive. So maybe knowing that will give you an idea about what we are talking about. It's very costly and very
Very expensive.
expensive.
Very, 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 very. And then also the time. The time it takes out of your valuable time. I know time is money, right? For wealthy people, time is money. I believe you all agree with me. For wealthy people, time is money. And the time it takes for for a disease to keep you in the house or in the hospital for all that long time is money. So having health insurance is better because in that case you can reduce that time because you are receiving treatment, right? So how we are answering the question: how does health affect your wealth? If your health is not great enough and you are taken out of your job, if you are working for somebody or if you're a businessman and you can't do anything because you are sick, you are taken ill, then obviously it is expensive too, like we were saying earlier. So time affects wealth. Any time spent outside of making money, outside of being rich, is time lost in terms of money. So that is that. And then access. You want to talk about access?
Access. So if you are at a place that you can't access the health care because of the condition that you have, it means that maybe you have to travel and the expenses is going to be even more because you have to move from where you are living to another place. And maybe you have to go see a specialist because it's not available in your area. You have to travel. So having the access to the health care can also take you off your job. It can incur more cost.
All right. So that is
It can
access.
affect your health, your
Yes,
wealth.
your wealth. It can access. Can affect your wealth. If you have to have, for some rich people, they would travel. Every no matter how far they would travel and get their procedures done. Right. Some rich people would travel as far as Europe, as far as the U.S., as far as India, just for a procedure to be done because they can afford it. But the point is, it takes from your bottom line. The money you made is going to be used for that. So health can affect your wealth in that respect. And then also, if we go to the third one, which is disease. If you are sick, and this one is a no-brainer, right? If you are sick, it's painful, and being sick, as we said, it also contributes to time. It's going to take you off your job. You cannot stand if you are a public speaker. You can go out there and speak because you are sick. It's affecting your wealth. You can't make money anymore. If you work for yourself in real estate, you are an agent. You got to go show up properties, and you can't go because you are sick. A disease is affecting your wealth. So, in that respect, that happens to affect your wealth. You want to talk about death or morbidity?
No, the disease states if you can't go, if you don't show up at work, if you
Yes.
don't punch in,
Yes. If you are also
it means that
punching,
you are not going to
then
create any wealth. You're not going to get any money at the end of that period. So
that's for
it can
people
affect your
who
wealth.
are employees, right? Yes. If you can punch, if you call out many times, no matter how good you are, people become suspicious, and if you don't take care, they may either write you up or even fire you. And if genuinely you were sick, that is making you poor right there. So diseases can affect your financial situation. And then the last one is morbidity and mortality. Morbidity basically means disease states too. But then the other thing is it can lead to death. And if you die, you're losing all the money. If you die, you can't take the money with you. You got to leave it here. And so your wealth, your health affects your wealth. It's very important. So if you see a rich person that does not care about their health, they really want to leave everything for other people to chop, which is okay, as long as they don't have any issues with whoever will take care of it. But definitely your health is affected. Your wealth is affected by your health.
And also, if your work is such that it's so demanding that you have to perform a work, and because of your disease state, you are not able to do what is expected of you, you may end up losing your job because you are not meeting the standard. So, indirectly, it's affecting your wealth because you are not able to perform because of your health issues.
All right. And so that is how health affects your wealth. Now, knowing that, then what do we do? What do we do? We actually want to go through a lot more of that. So uh, let's see. The first one we said cost, right? We want to go into a little more in depth explanation about the cost is the cost that is involved in getting sick, and maybe that would make you understand why we're talking about health insurance affecting your wealth. So when we talk about cancer drugs, uh, it is an average here about $10,000 per month for some cancer medications. And actually, the place I looked is saying that even up to $30,000 per month for some medications that are used to treat cancer. So healthcare is a money, a high intense money thing, business, if I should say.
A month. So like 12 months in a year. So we are looking at what, 120,000 a year.
120,000 a year just
Year.
to treat cancers, you know?
And you know your life depends on it.
Exactly.
So you are going to bring in whatever it takes. So it's not only your money. Sometimes it extends to your extended family. Everybody have to chip in.
Everybody has to
You
chip
know,
in.
GoFundMe will be out there that people are soliciting money here and there. So because it's very, very expensive if you are paying $10,000 a month
Paying $10,000 a month
just to live.
just to live for the treatments that you can get, you know. So it is not something that we can play with. And then also, that is just for cancers. I mean, we want to believe that people watching, nobody will get cancer. Keep fingers crossed, because we are paying for you, and we are also doing exercise and eating right and everything. So we can say that no, minus me. But still, there are other disease states that we know people face, especially as people get older, right? And so we cannot just say that, as for me, I won't get cancer, so I don't need health insurance. Well, you may need health insurance for diabetes. How about diabetes right there? You know, diabetes is also very expensive, you know, apart from the just the mere fact of being sick, having the disease. The cost in terms of finances is huge. Cost is not small. And according to my research on from the American Association of Diabetes, American Diabetes Association, I should say, $16,700 per year. And that was in 2017. 2017, 2017. All right. Just imagine. And now they actually projected that the cost goes up by 26% every 5 years. So with that 26% in mind, it comes to about 21,000 and change. I just rounded up. I just rounded it up to 22,000. So if 2017 was 16,700 per year for managing a diabetic patient, then this 2023, we are definitely going to be paying around $22,000 per year for managing a patient who has diabetes. And that is not cheap. So I don't know how much money you make. You know, I mean, these numbers are from the United States. So if you're watching from other countries, I'm pretty sure you can extrapolate to how your incomes are. But definitely, that is a huge amount. Some people make $22,000 the entire year. That's all the money they make.
Wow.
That's all. And so if you make just that money and you get hit with diabetes, what are you going to say? You see, so it affects. Diseases can make you destitute. It can make you just definitely somebody who is definitely losing everything. So that is just for that one.
Okay, so can we break it down a little bit? So like the expenses will include visiting going to the doctor's office, drugs if you're on insulin or medications, and monitoring with the test
Testing
kit.
kits and
Yeah, here and there.
all those insulin.
And maybe your diet, trying to stay on top, eating the right foods.
Those things don't include it.
Oh, really?
This is what is charged in the offices and medications. This is
Just that.
This
It doesn't include
it doesn't
the
include
food
how
you
you eat. No,
That is really expensive.
that is why we will say that insurance is necessary, right? Because if not, this can eat all your wealth. Just imagine having to deal with what we are saying now. Just imagine having to deal with $22,000 per year in managing your diabetes disease. And now, I didn't go into details about this, but the other things that come with diabetes may not even be covered. You know, I'm not sure if this includes the treatment for, cholesterol and high blood pressure and all those other disease states that are usually going with diabetes, right? So if those things are not included, those become additional charges for which you have to foot. So definitely cost 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 of healthcare can make a rich person very, very poor quick. All it takes is a couple of years. And especially if the disease state is very debilitating. One that makes it so hard for you to perform. You know, if you are diabetic and it is well advanced, you may not be able to do some of the things that you could do before you became diabetic, right? For example, you may not be able to just fly anywhere as a business, man, just making sure you are attending to business and making more money. You may have to cut down some of the frequent flying and travel because you want to eat right. You want to make sure that you are close to your doctors and attending office visits and doing your regular checks and stuff like that. That may be something you want to do. But then if you do not go out and make the money, you're also using the money you have already to pay for the cost of treating your problems in terms of your disease states. So definitely, it's not cheap. It's not cheap, and diseases can make you quickly destitute. In fact, some people have become bankrupt as a result of diseases, and we can go into that later. But definitely, that is something that can happen. And then also, on top of the fact that it costs $22,000 in between office visits and management in terms of diagnosis, treatment, and stuff. Out of pocket costs for patients, for diabetic patients, are about $4,800 per year. You have to come out of your pocket, apart from the 16 to 22,000 that you're going to be paying to doctors and nurses here and there, pharmacists here and there. You also have to come up with $4,800, and that $4,800 is out of pocket cost for testing supplies you may run out before your insurance will pay for it, or even some over the counter supplies that you may buy apart from the testing supplies. You may buy some vitamins on the shelf. You may do some other stuff. Maybe you will join some kind of a group that help with diabetics and stuff like that. All those things would definitely also come to around 4,800 out of pocket. That is without insurance.
Wow.
Yeah. And so that is something we want to make sure that we are taking care of.
And with this cost and what is entailed, we can say that then we have to be extra careful if you are not diabetic, or if you are pre-diabetic. You have to change your lifestyle in such a way that you don't even get to that point for you to spend that money, that cost, to incur that cost. So like if there are certain lifestyle that you have to change, if you have family history, then it's something that you have to take interest, that your diet should be such that you are not going to find yourself in that situation. The thing that I'm worried about is the size of metformin. It's so big.
That is
Medication
that
used
is
to treat diabetes, right?
Yeah.
So when I'm counting the pills, it's such that it's so big. I'm like, how am I going to take this? Maybe 2 pills twice a day. That is too burdensome. So whatever it takes to stay away from being a diabetic, I think our health channel, we've been talking about diabetes here and there, is imperative, that there is no way around it, that we should take care of ourselves so that we don't incur all this cost going forward.
All right. Now, with that being said, we also want to talk about the other disease states that also cost money. Remember, we are talking about how much cost healthcare is, and for which reason we suggest that you have health insurance, because it can eat up your wealth. If you don't have that, if you don't have insurance, and you just say that, hey, I'm good, I'm young, I can manage this, I'm not going to get sick. You got to watch out, because it's not always like that. It's not always like that. It is always the person who is whom you least expect to get sick that usually gets it and then they are like, I wish I had insurance, and it's too late. And we work in our places, in other jobs we do. We meet patients who there was a medication that a patient, an HIV drug actually, a patient was struggling to you have to be on the drug. You can't just leave because then you get resistant, right? And then they had lost their insurance. They had to take the medication, and they asked how much it would be. We're talking about, a couple of $1,000 for just 1 month supply. I'm talking about like $2,500 just for a month, just for a month. So if you don't have insurance, you don't play with it. Your wealth can easily go like that. And we'll talk about how you can probably overcome some of these things. But definitely important that we bring it out that healthcare costs are rising, and that the cost can affect your wealth. It can make you poor within a matter of moments. All right. So now, if we go back to, I think if we go back to our slide, we're saying that the other cost issue that we see, maybe you say that, oh, as for me, I won't get diabetes. Well, the first one you talked about cancer, minus me. Good. The second one we talked about diabetes, minus me. Good. But then the third one we're going to talk about then is high blood pressure, HBP. How about that? Minus you too, or you got it already? I'm pretty sure most people already have hypertension, especially with age and socioeconomics and stuff like that. Genetics, of course, most people have it. And that in itself costs at least another extra $2,500 on top of your other healthcare costs. So if you have hypertension and you are also dealing with something else on top of that, you spend another $2,500 per year for managing high blood pressure, which is, in a rich man's term, not bad, right? Not bad. Yeah, it's not bad for a rich man. But all God forbid, all you need is to have another big thing happen, and then every dollar will count. You don't want that to happen to you, and I hope that doesn't happen to you. So, definitely, that affects your wealth. So all of them do affect your wealth. I don't know if you want to add anything to it.
Good.
Good. All right. So then we'll move forward. So is health insurance necessary? I think I've already told you where I stand. I think I already told you where I stand already. Yes, I'm telling you, that's already where I stand. I don't know if you hear that on the fly, but my wife is hearing my sound effect and is laughing. Yeah. So yes, is health insurance necessary?
Did you answer it? Yes. Right.
I already have my own. I think you can tell where I stand. What do you think?
Yes.
Yes,
It's
right.
necessary.
It's necessary.
But it's so expensive. It's so expensive. And according to a little research I had, 1 in 5 Americans goes without health insurance or have inadequate insurance. The reason being that they cannot afford it. It's so expensive. So it's necessary, but is a something that everybody can afford. So that can be something that we can ponder over.
It's necessary, but well, now let's talk about the two major things that makes us come to that conclusion that it's necessary. The risk, health risk. If we know or agree that every human being at some point is going to get sick here and there, we don't hope for any major ailments. We don't hope for that for anybody. But you could get a headache. You could break an arm. I think it's major for some people. You could break an arm, right? You could also, catch a viral disease, the flu. You probably even caught COVID. But thank God for the government. Most places, COVID was treated for free. But the risk of getting sick is basically inevitable. We are children of faith, so we don't want to think that we're going to be sick and sick. No, we don't. We don't believe you're going to be sick. We believe that you can have an ailment, but you overcome it. That is where we stand. But even that ailment that you overcome, that little headache, that little flu, we still think that at least it is something that we should transfer the risk of paying for those to somebody else. And that is why health insurance is necessary. Otherwise, you can end up in severe cost issues that can make you lose your wealth. That is where we are coming from. So we say from the overall cost perspective, health insurance may be necessary, right?
Yes. And aside the common cold and the flu and the COVID and all the other things, we need the health insurance to follow up with our procedures or things that we have to do as we age. How do we say that one? Like we have to go do the mammograms, we have to go to
Screenings.
the doctor's office to do the pap smear. As women, we have to follow up with a doctor with our health, our women health, and all that. Having insurance will encourage you to go because it's so expensive. If you have the health insurance, it enables you to go. As a man, there are certain things that you have to follow. I think last time you talked about colonoscopy, you have to do your prostate, you have to do all that. So having health insurance help you to follow through those screening. If you do not have it, or your yearly appointment, right? Every year you have to know your numbers. I think you put it this way: you have to know your numbers, where you stand when it comes to high blood pressure, when it comes to diabetes, your sugar level, and all that. You need to know. So in order to know and not drain your wealth, you need to have the health
Health insurance.
insurance so that you can follow through. So aside the little diseases here and there, you need that for your screening and your annual follow-ups.
Right. The other thing is that even for some people, because of the lack of health insurance, they won't even go for the checkup. They don't go for anything like colonoscopy because it's going to be expensive. It's an expensive endeavor. So why would they go if they are going to charge them something that they cannot afford? They would rather stay home. But if you have insurance, when the doctors recommend, you're 45 years, you're 50, you need a colonoscopy done, you would just go because you know that you're covered, right? So it gives you that self-reliant, knowing that you can pay for whatever you are needed to do. But if you don't have insurance, you will put excuses for everything and stay until something sneaks up on you, which is not something that we want you to do. So definitely, insurance or health insurance is necessary.
It's necessary.
Now we said that it's necessary, and this is where our answer comes in. Yes, it is. It is necessary, and it is also affordable. It's affordable. Now, by affordability, what I mean is even if you don't get any government subsidized health insurance, which is available now, because of the state of your wealth. Maybe you make so much money, you're a millionaire, billionaire, whatever. You don't qualify for any of the government health programs. It is still cheaper for you to buy private health insurance than to be sick and then pay for it. Unless you just want to throw your money out, right? But if you want to keep your savings, if you want to keep your wealth, if you want to keep all the benefits of what people get through insurance, then you buy insurance, even if you can afford healthcare. Because as we said before, insurance pulls up, insurance companies pull up all the risk that people have, and then they manage the risk. So you transfer your risk to them, they manage it. Some people may not fall sick, but they are paying their premiums, and some people may fall sick. So they use that to make sure that they still make money, even though they pay for everybody's healthcare. So it is affordable in that respect, no matter what, even if you don't qualify. Don't say that, as for me, I make too much money, I'm not going to qualify for any health plan under Obamacare or under anybody. So I'm just going to just wait. If something happens, I pay. I got the money, I'm going to pay. No. You are wasting money. Put that money into an insurance, buy a good policy, and save the rest. Give it to the poor so that they can use it to afford insurance. All right. All right. So yes, that's that part that is affordability. Now you want to talk about employer.
I thought you said that I mentioned that it's costly, and you're saying it's affordable.
It's as costly if you don't. It is more expensive if you
If you
don't
don't have
have
the insurance.
insurance.
But what about I believe that I'm not going to be sick? So I'm just going to live because maybe I can say that last year I didn't fall sick. I never went to the hospital. So why should I waste money and have insurance, which I know for sure that I'm not going to use? I think most young people say that a lot. That I'm young, I'm healthy, I don't need insurance. So why should I spend money with insurance?
Well, that is where they are wrong, because we see young people who also get sick. You know, the least they could do is to buy some form of insurance, maybe not as expensive as their older folks, but to buy insurance and spend. When you buy insurance, we also talk about health savings account, and reserve much of your cash in your health savings account, or HSAs, which is money that you save basically for your health needs, whether now or in the future when you get older. So in that case, if something happens to you today, you're not paying much for insurance. You can still be taken care of. And if insurance doesn't pay for all of them because you are using HSA, you could use it to supplement whatever is left for you. But I do not believe that how young people should say that they are young and so they are not going to get sick, because we see young people that get sick. I'm right. Yeah,
Yes.
we see young people. It's just that it's infrequent, but you don't know if that young person who's not going to get sick is you, or that young person who's going to get sick is you. So if since you don't know, again, you protect yourself by using health insurance so that you don't get destitute, or you don't put your parents in undue financial situation. All right.
Yeah. And another school of thought too, people are saying that instead of me giving the money to the insurance company, I'd rather invest in health, um, like health stuff. Like I'm going to buy, live well, exercise, do all the basic things so that on my side, I know that I'm not going to fall sick for me to use the health sector. And I'm going to stay healthy because I'm going to invest my money in myself, in my health. What do you say about such
Well,
group?
I also disagree. Even with that, I'm sure you know the answer. You just want me to want us to have a discussion on
Yeah.
it. Yeah, I also disagree in that respect, because having all those good diets, eating well. Some people they have the perfect diet. They have the perfect lifestyle. They go to the gym. They exercise daily, 30 to 45 minutes, as we recommend for you on this channel. They eat the greens, the grains, and the veggies, the whole grain. What I'm saying. They are on top of everything, and yet because of family history, or even because of the environment that they may be in, they may still fall sick. So insurance, the health insurance, is basically after you've done all things, just in case something happens. And in fact, you still get the benefit of those exercises and everything, because your treatments are easier and you get over stuff better and stuff like that. So don't also say that, oh, if that's the case, then there's no need. No, there is a need.
There is a need.
Yeah, because
You can also get into an accident.
exactly,
Something can happen.
it can
So
happen.
we are all at
You
risk.
can
So
be
we
in a
need it.
serious accident, can become disabled in a minute. God forbid that happens. But if something happens, insurance is where you're going to fall on for replacement of your income sometimes, and then for health insurance, paying for the cost of the service itself. And as we're saying, we're going to talk in the future about how to leverage life insurance for even creating more wealth and stuff like that. But health insurance is the basic. If you don't have health insurance, forget about life insurance, because you don't want to live here. You just want to make money and die and give the money to somebody. I disagree on that. So that's why we're starting with that is why we're starting from the basics. Get health insurance, because that is the first. That means that you actually want to live well. You want to live here. You want to be around for your family and for your friends. And then if God forbid something happens, that's when you fall on the life insurance. All right. So let's go forward. And I think that our on our slide, we also said, apart from that, the fact that it's affordable, where we had to branch off. Now, people who are employed, you get health insurance through your employer. Most employers, I should say. Some employers don't have the capacity to give health insurance at the, to the employees, and so you have to go out and apply for health insurance through the marketplace, the Obamacare marketplace, which is the healthcare.gov, where we're telling you that today is the last day. If you haven't applied, you got to do it today or you lose it for the entire year. So that is where it is. And for those who get employee health benefits, it is a group insurance.
Right.
And because it's a group insurance, you pay less than if you go out there and buy it yourself. So that's the benefit of working for somebody who provides health insurance. And I know most of you already know this, but we just want to make sure that people who are not taking advantage of health insurance at their jobs, you are actually throwing money down the drain. All it takes is something bad happens to you, and you can be in dire financial straits. You don't want to be there. So take advantage of the employee or employer sponsored health insurance, because the group insurance, it doesn't cost them anything. Well, I shouldn't say that. They take the money from their taxes. So
Right.
even though it costs them, they will claim the money back. So if you refuse it, you are actually missing out on something that is made available for you. Not just because you are young. No, get it some way. You want to say
As
something?
long as it's available. I think almost every year, every job will send you reminder or something that you need to select one health insurance. I know there are types of insurance which we don't want to delve deep into. We have the bronze, the gold, the premium. So, like we're saying, if you're young, just don't say that you don't need it at all. Maybe you can apply for the bronze, you know. It's still a form of insurance so that you know that you are covered. You're not going to say that no, they will take money out of my my paycheck and I don't make much, so I'm not signing up for it. You need health insurance. So as long as it's available, please make use of it. Take advantage of it and apply for it.
Definitely, definitely, definitely. And also, there's also another form of, I think I already mentioned the Obamacare, which is the marketplace for shopping for insurance. And then there's Medicaid, which is the state where you are. Basically, insurance that is available to people who don't make a lot of money. I'm believing that we want to make money, but you got to start from somewhere. So if you don't have enough money to buy health insurance, you can start off from the state where you are and see if you can get some assistance in terms of health insurance. And then once you get on your feet and you start making the money, trust me, they themselves will drop you because they know you can pay.
They'll drop
They
you.
will drop you. They won't cater for it anymore because they go by your income. And then once you have made enough money, you can pitch into private health insurance, either through the Obamacare or your employee health insurance, or if you are a self-employed or business, independent contractor, you can also purchase or private insurance through the Obamacare marketplace. So definitely affordable. That's the key. We are saying that it's affordable for the rich. It's still affordable, and for the poor, it's affordable. No reason to say that I'm not going to get health insurance especially because nobody in my family has ever been sick. We are all fit, we are all young, and so no, 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 no. That is a recipe for disaster. Because as we said, all it takes is one catastrophic ailment or disease, and you can be bankrupt quick. You may not even be able to pay your mortgage or your rent. So why do you want that to happen? Just protect yourself. Insurance is basically protection, right? So that's
Protection.
what it is.
Transferring the risk.
The risk. All right. So let's see if there's anything else we need to talk about. We also say that in continuation of that, apart from the fact that those insurance opportunities are there through your job, you also get tax deduction, tax benefit, or how should I say, tax exempt income. So before your employer pays you your tax income, they will take out your contribution for the health insurance. So if your contribution is $200, for an example, they will take that out before they submit the rest to IRS for IRS to tax you. So basically, the money you contribute towards insurance is free of tax, and employers are also taking it from their taxes. So it's a win-win situation. So there's no need for you to say that, well, my paycheck will go down if I pay. Yeah, it will go down some, but remember that it's not just going down, it's going down to protect you, because you need to protect yourself against the uneventful disease that may show up when you least expect it, right? All you need, as again, as I said, is at least just put it a small one and put the rest in a HSA, which we're going to talk about.
Yeah, and also if you know that they are taking money out of your paycheck, maybe that will give you the reason why you should make use of the health sector, because they are taking your money. And taking your money means that you have to benefit from it. So maybe that will encourage you to follow up with your annuals, your
Screenings.
your screenings and all that. Otherwise, yeah, you are throwing money away. So let them take the money, and that may motivate you to make use of the health sector by visiting your doctors annually. Even if you are not sick, just once a year, you go and you check up all the basics, and you know your numbers, and you move with it.
Definitely. That's a very important thing that you brought up. That is very important, because even if the health care benefit you get from your insurance, if all you get is your annual screenings, that's just enough. Trust me. To be able to just go to the doctor once or twice a year to make sure that your blood pressure is on point, your blood glucose is on point, your blood cholesterol is on point. And apart from that, if you are a lady, they have checked you, pap smear is done, your breast has been examined, maybe you had your mammogram done. If you are 45 and older, or maybe they did your colonoscopy, make sure that you don't have any colon polyps growing up in your colon. I mean, those basics, if you have insurance that even takes care of them, that is enough. Because if you add those together, those alone can be a big chunk of money. And the thing is, as you go and check all these things all the time, not only will you be protecting yourself, but if something happens to be hiding in the background, they will see it. And again, because you have insurance, they can take care of it. But if you wait and say, I'm healthy, I'm good, I'm not going to spend money, my hard-earned money, I don't want anybody to take my money for insurance, well, go ahead. But I hope you're not going to go ahead. Yeah, don't go ahead and do that, because we need you to be healthy. That's what we are about on this show, the Life and Health Show on Dayspring. All right, so we are going to go back to our slide and see if there is anything else that we need to hit on before we bring the stream to an end. Yeah, so we also talked about the fact that your healthcare contribution towards your insurance is deductible, right? And there's this one is huge, the HSA, health savings account, especially for young people who don't want to put a lot of money towards the insurance. You have to get this when you have insurance. So if you decline to get insurance, I'm not sure of the law, but I think if you decline insurance, you may be declining HSA too. The HSA is a sum of money that your employer contributes, and you also contribute, I think, towards it. And then you have some benefit maximum that you can contribute yearly. Do you have the number?
Yeah, so I think this program is something that the government's brought up so that it help cater for people that are having like serious diseases, and they are going to go bankrupt because they don't have a lot of money towards health insurance. So it's something that is huge now. So if your employer offers it, please take advantage of this, because I remember this older woman came to my job and she was telling me how much she was unable to contribute to the HSA, and she was able to contribute just a little bit, but one sickness, the husband got into it and all the money has been spent out. But at least that protected them for that period of time. So it's something that you have to take advantage of. And for family contribution, my research shows that you can save $7,750 a year that you can put aside just for your health care problems,
yeah.
needs. So, like when any of your family members are sick, you can use that as a copay, as the expenses towards your copay, the expenses that insurance do not cover. You can use that money to pay. And a single person, you can contribute as much as $3,850 a year. So, apart from contributing to the insurance, you can also set money aside and save that on your HSA. And the HSA do not go like
It
doesn't
doesn't expire.
expire as compared to the FSA. The FSA is the flexible
Spend,
savings account,
spending.
spending account. So the flexible one, you have to use it up by the end of the year. But the HSA, you can keep putting money on there, which is available to you as long as you live. And it's non taxable. So you're putting money on the side to help cater for problems later in life.
Definitely, definitely. That is important. That is very, very important. That especially for those young ones who don't want to contribute so much towards their health insurance, get a health insurance, but then make sure you select the HSA also, and then because if you have the HSA and you select an option of your health insurance that is high deductible, health insurance, then you use your HSA as a means of paying your deductibles. So in that case, if you don't use the healthcare system, since you didn't use it, you don't pay it. It's on your HSA. So it's there in the future for you to use whenever you need any major healthcare expense. And for if you are a young person and you start doing it early, by the time you get older, you may have huge sums of money on your HSA. And then you won't worry about if some procedure is not covered or if you have a copay of any kind because your HSA has built up so much. And then if you have it too and you have to use it, for example, you have an issue that had to be taken care of and you can afford it, you just swipe your HSA card and they pay for it. And so again, that is also money that is tax free and it's not going to expire like the FSA used to be. So health insurance is good, and especially for this one, I think it is very, very important.
And I think some employers also match it or contribute parts of
Yes,
the
yes,
money.
yes, yes,
So it's
definitely.
like the employer is also contributing into the HSA. So if you have a job that has that service, please look into it, research, and make use of it. It's very beneficial.
Definitely, definitely. The employers definitely do contribute towards HSA. So make sure that you take advantage of it. Definitely take advantage of it. Now, we about to wrap up. We are actually wrapping up right now. We want to also talk about the fact that the importance of health insurance and why you definitely need it. I think we said a lot of them, but just so we do not you do not forget, we want to hit on these a few points, and then we will bring the stream to a close. We say that use health insurance to reduce your taxable income. Okay, so if you contribute towards health insurance up to some limit, your income is whatever you contributed is tax deductible or tax free. I don't know if it makes sense that way. But basically, if you put portion of your income towards health insurance, you don't pay taxes on that portion of insurance. But if you collect all your income, they will all be taxed. And then when you are sick and you use it, you are going to use it to foot the bill. So why do you do that? Why don't you just set money aside, which the government will not touch, and then you use it for your healthcare needs? So that is one benefit of health insurance. And then it will also help you avoid getting bankruptcy when you get a serious disease state. Like we started with, cancers costing $10,000 per month. People have to sell their home. Until the
Wow.
advent of Obamacare, many people went bankrupt because once they get sick, the insurance companies had a limit. They would say that you have a maximum of $100,000 to use per year. And if you meet that 100,000, if you're using, $10,000 per month, you can imagine that will go
One
out
year.
quick. Then the insurance will
Wow.
drop you. So just
Wow.
imagine if you're in that position. But now, because of Obamacare, you don't have that limit. All right. But if you don't have Obamacare, if you don't have insurance and you are sick, you are not going to be able to say that I don't have that limit. You are going to have to come up, either sell your house or maybe sell your children. In order to foot the bill. I mean, your children will have to stop doing whatever and bring their money, their income to take care of you. That's basically selling your children because they need to work for themselves. Now they are working to pay for your healthcare bill. So you don't want to get in bankruptcy. And
And also with the bankruptcy, so like if you go over the reason why people file for bankruptcy, I think a health is about the second or the third that that will
highest
be,
reason,
yeah, reason why people will file for bankruptcy. So it can easily bankrupt you. You can lose everything
quick,
very quickly. So yeah, having insurance is very, very important.
very
Yeah.
important, very important. And the last one is, again, to reiterate, the last one is insurance is a transfer of risk. Everybody has health risk in the future. As you grow, we know that physically you don't feel as you want to. Though we believe that by faith you can stand and live and be healthy for a long time. But we also want to make sure that you also do what, in terms of human beings, we are responsible to do. Just make the money available for you. All right. So transfer the risk of getting sick and paying for it, the risk of getting all those huge bills to take care of your ailment or your aging status and stuff that happens with age, old age and stuff. Transfer that risk to a company that is specialized to manage risk. Pull resources from a lot of people in the same age group or maybe in the same risk level, and then manage the risk for you so that they will pay you for when you need the help, rather than to say that I'm going to take up all the cost myself. I got the money. It is not the right thing to do. So transfer the risk to the insurance companies, and then they will take care of you when you need it. Even if they don't do the best job, at least the little that you will pay will still be less than what you would have paid if if you were taking the whole risk on yourself.
With the Obamacare, I think you have to have the documentation to apply. So people that do not have documentations, they don't qualify for Obamacare or Medicaid or anything of that sort. But we are not forgetting about you. If you have any health issue or if you need to follow up with your health, which we are encouraging everybody to do, that at least once a year you have to follow up. There are services out there. Don't exempt yourself. Don't say that I don't qualify for this, I don't qualify for that. There are a lot of services out there. So if you want to reach out to us, we have places that we can direct you to. You need to follow up with your health with insurance or without insurance. With insurance, if you qualify, but if you don't qualify, there are avenues out there that you can also channel to that can help you.
All right, all right, all right, all right. That was a good show. That was a good show. That was a good show. All right, so we are wrapping up the show. We want to bring the stream here. We want to say thank you for staying up all this while with us as we bring it to a close. We want to say,
Beloved,
beloved,
we
we wish
wish
above
above
all
all
things
things that
that
you
you
prosper
prosper and
and
be
be
in
in
health,
health
even
even
as your
as your
soul
soul
prospers.
prospers.
Thank you
Thanks for
and God bless
watching.
you.